So I want to quickly talk about what I saw today that really upset me. There was a consensus statement written by the American Academy of Pediatrics. And the consensus statement was two authors who were asked by the Academy to talk about low-carb diets. They consulted not any metabolic health practitioners. They cited only one real study that supported low-carb diets, and it was incredibly biased. In fact, most of their evidence came from an old way of doing ketogenic diets based off trials for kids with epilepsy who have a very high 90% fat diet. They talked about transient carnitine deficiency as if it's something that people with Atkins or modified Atkins or just, who are eating the modern sort of ketogenic diet, which is fairly, meat-focused, higher protein. Anyway, it was hypercritical and it recommended against it, said if patients want to do it, that they should be highly monitored. And yet the American Academy of Pediatrics also says that vegan diets are perfectly fine. It wasn't the same authors that wrote that, but it was those the same institution. And the American Academy of Pediatrics also said that we should give, adolescents with obesity injection drugs, and they had no problems recommending that, although there's no long-term data. They had no problems recommending vegan diets that have no long-term data, and they had no problem recommending bariatric surgery for adolescents, and we know there's so many long-term complications, including nutritional deficiencies, suicide, and a host of other issues, alcohol use disorder, etc. So overall, I'm disappointed in the Academy. It's just disheartening. It's disheartening to see. And stay tuned from the SMH. We're going to have our own consensus statements, which I think will be a little bit more balanced and evidence-based.